7 calcium channel blocker side effects you should know. Calcium channel blockers, often referred to as CCBs, are a widely prescribed class of medications used to treat high blood pressure and other heart-related conditions. They work by relaxing blood vessels, which helps reduce strain on the heart and improve blood flow. There are 2 main types of calcium channel blockers. The first group is dihydropyridines, DHPs, which mainly target blood vessels. Medications in this category usually end in pine, with examples including Amlodipine, Norvasc, Keterzia, and Nifedipine, Procardia. The second group is non-dihydropyridines, non-DHPs, which focus more on the heart itself by managing the speed and strength of the heartbeat. The 2 most common drugs in this group are Diltiazem, Cardizem, and Verapamil, Verilon, Calin SR. While calcium channel blockers are highly effective, they are also linked to certain risks. Understanding possible side effects is important if you've recently been prescribed one of these medications or are considering treatment. Here are 7 calcium channel blocker side effects you should be aware of. 1. Constipation. Constipation is one of the most common side effects of calcium channel blockers. It happens because the same muscle-relaxing effect that helps blood vessels can also affect muscles in the digestive tract. This slows down movement in the intestines, making bowel movements harder or less frequent. Among all CCBs, Verapamil and Diltiazem are most likely to cause constipation, with Verapamil being the leading culprit. Studies show that up to 11% of people taking Verapamil may experience this issue. To manage constipation, lifestyle adjustments such as increasing dietary fiber, staying well hydrated, and exercising regularly can help. In some cases, over-the-counter laxatives may provide short-term relief, but always consult your healthcare provider before using them long-term. 2. Swelling in the arms or legs. Another common calcium channel blocker side effect is swelling in the arms or legs, also known as edema. This occurs when fluid builds up in the tissues, leading to noticeable puffiness or discomfort. Edema is more common in certain groups of people. Research shows that women taking calcium channel blockers are more likely to develop swelling than men. Age also plays a role, with older adults facing a higher risk. Environmental factors, such as warm weather or hot working conditions, may make the swelling worse. Not all calcium channel blockers carry the same risk. Dihydropyridine, DHP, CCBs are about 4 times more likely to cause swelling than non-dihydropyridines. The likelihood also increases with higher doses or longer treatment durations. Unfortunately, this side effect does not always improve with time. Still, there are steps you can take to manage it. Elevating your legs, wearing compression stockings, or adjusting the timing of your medication to the evening may help reduce swelling. In more persistent cases, your healthcare provider may recommend switching to another type of medication. 3. Slow heart rate. A slow heart rate, medically known as bradycardia, is another potential side effect of calcium channel blockers. This is most commonly associated with non-dihydropyridine CCBs, such as Diltiazem and Verapamil, which work by lowering the workload on the heart. For most people, a slightly slower heart rate does not cause noticeable symptoms. However, if you experience dizziness, chest discomfort, or shortness of breath, it may be a sign that your heart rate has dropped too low. If you notice these symptoms, it is important to contact your healthcare provider right away. They may need to adjust your dosage or evaluate whether a different treatment option is more suitable. 4. Dizziness. Dizziness is a well-documented calcium channel blocker side effect. It often presents as lightheadedness, weakness, or feeling unsteady. This typically happens when you first start treatment or when your blood pressure becomes too low. Dizziness may also occur when you change positions suddenly, such as moving from sitting or lying down to standing. To reduce your risk, rise slowly and give your body time to adjust. The likelihood of dizziness increases with higher doses of calcium channel blockers. The good news is that, for many people, this side effect improves as the body adapts to the medication. If dizziness continues to affect your daily activities, consult your healthcare provider for guidance. 5. Fatigue. Fatigue is another common complaint among people taking calcium channel blockers. Like many blood pressure medications, these drugs can leave you feeling more sluggish or tired than usual. In most cases, fatigue improves over time as your body adjusts to the medication. In the meantime, regular physical activity, a balanced diet, and staying hydrated with water and electrolytes may help boost your energy levels. If your fatigue becomes severe or persists, it's important to speak with your healthcare provider. Excessive tiredness may signal that your blood pressure or heart rate is too low, requiring a medication adjustment. 6. Flushing. Flushing is another common side effect of calcium channel blockers. It appears as redness and warmth of the skin, often in the face or upper body. This occurs because calcium channel blockers widen the blood vessels, allowing more blood to flow into the tissues. Flushing is more likely with dihydropyridine CCBs, such as amlodipine. Studies show that women are nearly 3 times more likely to experience this side effect compared to men. It also tends to be dose-related, meaning the higher the dosage, the greater the risk. In most cases, flushing improves as your body adjusts to the medication. However, if it becomes persistent or bothersome, let your healthcare provider know. They may recommend adjusting your dose or exploring alternative treatments. 7. Worsening heart problems. While calcium channel blockers are effective for conditions such as high blood pressure and coronary artery disease, they can sometimes worsen other types of heart issues, particularly heart failure. This risk is especially relevant for individuals with systolic heart failure, a condition where the heart has difficulty pumping blood effectively. For this reason, calcium channel blockers, especially Verapamil and Diltiazem, are usually avoided in patients with this form of heart failure. If you have a history of heart problems, it's important to discuss your full medical background with your healthcare provider before starting treatment. This allows them to determine the safest and most effective therapy for your condition. The bottom line: common calcium channel blocker side effects include constipation, fatigue, and a reduced heart rate. Dizziness, flushing, and swelling in the arms or legs are also possible. For most people, these effects are mild and temporary as the body adjusts to the medication. However, calcium channel blockers can carry more serious risks in certain individuals. Most importantly, they should generally be avoided in people with systolic heart failure, where they may worsen the condition. Because side effects can vary depending on the exact drug and the individual taking it, it is essential to consult your healthcare provider for guidance tailored to your health situation. If you found this video helpful, don't forget to like, share, and subscribe to the HeInfo channel, your all-in-one destination for trusted, science-backed health information. We publish reliable, easy-to-understand health content to help you make informed decisions about your well-being. Hit the notification bell so you never miss our latest videos on medications, health conditions, and everyday wellness. And if you have questions about today's topic, drop them in the comments below. We'd love to hear from you.